Hi there, my name is Samantha Schubert. I am a doctor of physical therapy and an orthopedic certified specialist. Today we're going to talk about the knee. Um, so we're going to talk about some knee exercises, some knee range of motion exercises, strengthening and stretching. These exercises are appropriate for people that have had a knee replacement or a knee scope, or if you just want some general exercises to help improve your knee strength, range of motion, and stability. This is not appropriate for people that have had an ACL repair or a meniscus repair. Okay. I would also recommend that you consult with your physician and your physical therapist before starting any exercises. So the first exercises we're going to discuss are knee range motion exercises. Knee range motion is very important as we need full knee extension for walking, and knee extension is actually the range of motion that is more difficult for us to regain after a surgery or after trauma. People tend to place pillows and things under their knee as a position of comfort after an injury, and that can actually do more harm than good. So if you have any surgery or any knee issues, please refrain from putting any pillow or resting for a long period of time with something under the knee. It can actually cause a knee contracture where the muscles, like your hamstring and your gastroc muscles, will start to shorten, and then it'll be much more difficult for us to get full knee extension restored. So we'll talk about some knee extension exercises and stretches, and then also some knee flexions. So let's start with knee flexion first. I have a strap. This is actually a strap from a robe. You can use a stretch strap. You can use a belt. You can also use a dog leash. That will work as well. So the first one that I'm going to show you, I have a slider. I'm going to put my heel on the slider, and then I'm going to lay back. Okay, and I'm going to try to actively bend my knee as far as I can. And then once I get to a point where I can't bend it anymore, I'm going to use the strap and gently pull, and then hold for about 5 seconds, and then straighten it back out. And typically I'll set a timer for about 2 minutes for this exercise. Bend and hold for 5 seconds, and then straighten back out. The next exercise I'm going to demonstrate for knee flexion is in sitting. So for this one, you're going to plant your foot. Okay, pretend this is the knee that I'm treating right now. You're going to plant your foot. You're going to trying to bend the knee back as far as you can, and then you're going to scoot forward in the chair, and then hold that for 5 seconds, 5 to 10 seconds, and then back. So this time I'm going to start with my heel all the way at the couch, and then I'm going to move my body forward until I feel the stretch in my knee, okay? And then I'm going to hold that for 5 to 10 seconds. And again, I would set a timer for about 2 minutes for this one. And then back, okay? So that's the second option. Next option I have is in standing. So I'm going to put my foot up on a chair, a step, or a stool. Make sure it is stable, okay? And then from there, you're leaning into it this way. This is a much more advanced stretch. This is a knee flexion stretch that would be appropriate for somebody that is further along in their rehab process, because you are getting to end range. And I tell people about 10 reps of 10-second holds and then back. Another great option for knee flexion is if you're lying on your back against a wall, with your bottom against the wall and your legs up the wall, and then you're able to let gravity help you to bend the knee, and you're trying to get that to end range and feel the stretch with that one. Now let's talk about knee extension. So like I said before, knee extension is much more difficult to restore. This takes prolonged stretching. So what I typically tell patients is to shoot for 30 minutes twice a day with your heel propped up on a pillow. I'm going to demonstrate using a foam roller here and then using some type of weight to put on your thigh, not on the knee joint, but above the knee joint on your quad. This stretch can get very uncomfortable and very achy. So it's okay to kind of take breaks between this. You want to make sure that your toe is pointed directly towards the ceiling. People will start to turn their toe out towards the side, and then you're not getting the stretch that you need. Right now I have this dumbbell. We'll see if it balances. I'm going to lie back, and this is a good one to put on a show on the TV and just kind of let gravity take your knee into extension. And then also throughout the 30 minutes, you want to try to actively extend and push the knee down, holding for about 10-second holds, and then relax. So the back of the knee is going to get achy. Typically that will start to get achy after 2 minutes or so. You want to kind of work your way up to that 30-minute hold. It is very challenging to get knee extension back. That's why I emphasized earlier not to put anything under the knee while you're resting. Another way to improve knee extension is a prone hang. That one, you can put an ankle weight around your ankle, and then you're going to lie on the edge of your bed. Your knee joint is going to be off the bed. You don't want your knee on the bed for that one. And then you let your legs go into extension that way. It would be hard for me to demonstrate that right here, but you're on your stomach with a weight around your ankle. So you're on your stomach with a weight around your ankle. You want the edge of the bed at the thigh, not at the knee. And then you would just lay there. This method is also can be very, the knee can get very achy with that as well. Okay, now we're going to talk about some stretching methods for the hamstrings and also the calf muscles. The first one I'm going to demonstrate is lying on your back. Again, you'll need a stretch strap. Okay. And there's several different ways. A static stretch. You can hold this for a minute, 2 times. And then you can also do a dynamic stretch where you're bending and straightening. Notice how I have my toes pulled towards me. That increases the stretch in the hamstring as well as in the calf muscle. If you do this with like a pull-up band, you can really make this a dynamic stretch. Okay, so that's one way. Another way, if you want to sit and do the stretch, you're going to sit at the edge of the chair. The strap is going to be close to the ball of your foot. You're straightening the leg, pushing the knee down, and then you're trying to hinge forward through your hips, not just bending forward this way, okay? You want to try to keep your back flat and lean forward. And again, you would hold for two sets of 1 minute holds. Next stretch I'm going to demonstrate is a calf muscle stretch. I'm going to demonstrate using my dresser here. You can also use your wall. You're going to take a big step back with the leg that you are trying to stretch. You're going to think about trying to keep your toes pointed directly forward. What people tend to do is let their foot point outward at an angle, and if you do that, you're not actually getting the muscle, the intended muscle. So you want to make sure that toe is pointed directly forward. You're trying to drive the heel down into the floor, and then if you feel a stretch there, that's great. If you need to increase the stretch, then you'll bend that front knee. And again, you can hold this for a minute, 2 times. So that's for the gastroc muscle. There are 2 main muscles in the calf, gastroc, medial and lateral gastroc, and then also the soleus. The soleus muscle, to stretch that, you're going to move that foot slightly forward, and then this time, instead of that back leg being straight, this time you're going to think about bending the knee. And this stretch, you're going to feel it closer down towards the ankle, in the back of the ankle. And again, 1 minute hold, 2 times. Now we have talked about stretching the hamstring, stretching the calf muscle. Now we need to talk about stretching the front of the leg, the quad and the hip flexors. So for the quad, you can do this in side lying. Lie on your side. If you can, grab your foot and then hold that position. Okay? If you are not able to do it that way, get a strap, put the strap around, and then you can pull backward with the strap. You want the knee of the leg you are stretching backward, okay, in line with the other foot or other knee. If you have it forward, you're not really getting much of a stretch on the quad. So you can also do it lying on your stomach. This way you know the knee is not coming forward, and then pulling the heel towards your bottom. Okay? There's a way to do it standing as well, if you have good balance. So for the hip flexor stretch and standing, you're going to stagger your stance like you did for the gastroc, your calf muscle stretch, okay? This time, you're going to focus on your pelvis, okay? So to feel the stretch in the back leg and the front of the thigh, you're going to think about pulling your tailbone under, so tucking your hips under, okay? And a lot of the times, as soon as people tuck that tailbone under, they feel it immediately. If you need to bend that front knee a little to feel it, then go ahead and bend that front knee. You can also increase the stretch by lifting that arm on the same side, lifting it and reaching towards the other side. This does take a little bit of balance, so if you need to grab a wall or a chair to hold on to, I do recommend that. So that is the standing version. I'll demonstrate the kneeling version of this. I just grabbed a foam block to put my knee on for comfort. You can also use a pillow. Okay. So from here, it's the same thing we did in standing. You're going to tuck the tailbone under and then lean forward until you feel a stretch on the front of the thigh. Okay. The next step to increase the stretch is reach up. Okay, and then the step after that is to elevate the foot. I'm gonna use the foam roller for this. You can use a foam roller. You can also use a chair to put the back foot on, or a couch. Okay, so tuck the tailbone under, reach up, and then you should really feel that stretch all the way up into the hip flexor. All right. So that's a lot of stretches. Obviously, the kneeling one is not going to be super comfortable for people that have had surgery. So that standing hip flexor stretch is going to be more comfortable for those that have had surgery. The next set of exercises is going to be more about muscle activation. So after a surgery or a trauma, your quad muscle tends to not work properly. Those muscles are not firing the way that you would hope, and they're just weak. So it is a physical therapist's job to help you get that muscle firing again. The first one that I'll demonstrate is a quad set. For the quad set, I typically will roll up a towel and put it, this one might be a little too thick. There we go, try it that way. Roll up a towel and put it under the knee to give the knee something to push down into. When we do this, we are trying to activate your quad muscle, and then you're holding it for 10-second holds. Your heel may come up off the floor, okay? And that is, that's okay. So we want to hold these for about 10-second holds and then relax. Just so you can see this set up a little bit better, I have the towel roll under my knee, okay? And then I'm activating the quad, as you can see here, and my heel is coming up off the floor. And then I'm holding that for 10 seconds. And then relax. And then activate. And then relax. So we've worked on a quad set. You got your quad firing. Now let's work on something called a short arc quad, okay? I'm using a foam roller under my knee for this exercise. You can roll up a pillow. That will work as well. So for this one, you're going to think about bringing your toes towards you, and the goal is to activate your quad right here. So you're lifting the heel up, squeezing the quad, and then slow lower back down. Lift up, squeeze the quad, and slow lower back down. A way to make this one more challenging is to add an ankle weight. And then you will also be ready to progress to a long arc quad. For that one, we need a chair. You can also sit at the edge of your bed, and then you're straightening the leg, bringing the toe towards you, and then back down. Straighten and back down. For the short arc quad and the long arc quad, I typically tell patients to try 3 sets of 10, or work your way up to that. Start with like 2 sets of 10, and then start to do 2 sets of 15, 3 sets of 10, and 3 sets of 15 to really work on improving their quad strength. The first exercise I'd like to introduce for the hamstring is a hamstring isometric. So you're going to lie down on your back, and you're going to bend your knees. You're going to lift your toes up, okay? And then you're going to think about trying to drive your heels down into the floor and think about trying to pull your heels towards you. Hold for 10-second holds, and then relax. Dig your heels in, pull, hold, and then relax. So you can do this for 2 minutes, holding 10-second holds. Or you can, if you like to count, you can do 2 sets of 10-second holds. Okay. And while we are in this position, I also want to introduce the bridge. So with the bridge, this is going to work your glutes, hamstrings, and quads. The placement of your feet can kind of dictate where you might feel this more. So I like to tell my patients to try to bend their knees as far as possible. And then from there, you're going to think about tucking the tailbone under and lifting one vertebrae at a time up off the floor or table or your bed, and then slow lower back down. Tuck under, lift, and squeeze your glutes. Hold for 3 to 5 seconds, and then back down. You should feel this in your glutes, hamstrings, and a little in your quads. You should not feel this in your back. You might feel a stretch in your back, which is fine, but it should not be painful. If you do, your positioning of your feet may be off, so just adjust your feet either forward or backward to see if you can get the pain to go away. It is very common for people to get a cramp in their hamstring with this. Try to work through that cramp feeling as long as it is a cramp and not a sharp pain. Another exercise for the hamstring, you can lie on your stomach and pull your heel towards you and then slow lower back down. So this is called a prone hamstring curl. You can add weight to your ankle to make this more challenging. And then another way to do that exercise is in standing. You'll need something to balance with, either a chair, the wall, and then lift your heel towards your bottom. Again, you can put an ankle weight around your ankle to get more resistance. Okay, so we've talked about some range of motion exercises, some muscle activation exercises, and the stretching. Now we're going to advance some of those exercises. As you get a little bit stronger in your quads, you can advance to a straight leg raise. This exercise will help improve the strength of your hip flexors. However, if you do not have good quad control and your knee bends slightly when you lift the leg, this is not an exercise for you. So what I mean by that is when you're lying down and you're able to get the quad contraction, but as soon as you lift, your knee bends, this is not the right exercise. You're not ready for this exercise yet. So the first thing is we get a good quad contraction. That leg stays nice and straight, toes pulled towards you, and then you're lifting up, and then slow lower back down. lift up, slow lower back down. So for this one, I would also recommend 2 to 3 sets of 10, depending on your tolerance, ensuring that that leg stays nice and straight as you lift up. Okay. From there, you can roll to your side. We have a few exercises you can do on your side for the hip. The first one I'm going to demonstrate is going to be a clamshell. This is one of the basic ones that you can probably start on pretty early in your rehab process. Your feet are stacked, your knees are together. You want to make sure that hip stays rolled forward. You're lifting that knee up. You should feel this in your glute and then back down. Lift up and really squeeze your glute. You can put your hand here to really feel and to make sure that you're activating the right muscle. The next one is that bottom knee stays bent. The top leg is going to be straight and you want it in line with your body. Again, you want to make sure that hip stays rolled forward and you're lifting that leg up and down. So this is a side lying leg raise. Okay. This also targets that side glute. You can also lie on your stomach and you can keep the leg straight and do a leg lift this way. A lot of the times I will have patients put pillows under their stomach to make this a little more comfortable. And then you can also bend the knee to take out the hamstrings and then lift, and that's more glute. And the movement, as you can see, is not that much when you're lying on your stomach. Okay, so those are some table exercises. Now let's talk about some standing exercises. So the first standing exercise I'm going to go over is a calf raise. You want to stand with your feet about hip width apart, feet pointed directly forward. You're going up onto your toes, pushing through that big toe, and then slow lower back down. Lift up, and then slow lower back down. There's a few variations to this. You can do feet straight forward, feet angled slightly outward. This hits a different part of the gastroc, and then feet slightly in. Would hit another part, okay? Some advancements through the double leg heel raise is going up, lifting one foot, and then slow lower back down. This would be considered an eccentric as you're going down. Okay, I'm going to do some on the other leg so you can see that I am lifting and then lowering. Okay, and then from there you go to a single leg calf raise. Okay, you want to really think about pushing through the big toe as you lift up to avoid that ankle from rolling outward. The next one is a toe raise. So you're going to lean against a wall, okay, and then you're lifting your feet up and slow lower back down. So both feet are coming up and then down slowly. This works the front part of the leg, the lower muscles down here. A lot of patients, when I give them this exercise, they say, I didn't realize how difficult that exercise would be. Okay. The next one is going to be a TKE, which stands for terminal knee extension. You can use a small ball for this one. I'm going to roll up a towel. It's going to go behind the knee. It needs to be slightly thicker than that. You can also use a pillow. Yeah, there we go. Okay. here I am pushing. This is like the exercise when you're lying down trying to make your quad contract. Okay, I am trying to contract the quad here, hold 10 seconds, and then relax. You want to try to focus on the quad muscle and not engaging your glute. Okay, 10-second holds, 10 times, or you can time yourself for 2 minutes. Okay, let's say that you have really good quad control now and you're ready to advance. The next one we're going to work on is a heel tap. You're going to need a step. The foot that's on the step or block is the working leg. The other leg is kind of hovering. This is a lateral heel tap. For this one, you're going to think about shifting your weight backward, bending the knee, tapping the heel, and then coming back up. So that's the lateral. There's also the forward heel tap. So the hanging leg comes slightly forward. This one requires you to bend the knee a little bit more. And you're really thinking about trying to sit the hips down and back, okay? Not just letting the knee come forward. So you're hinging at the hips and the knee. As a physical therapist, we are all about function. So one of the exercises I give most of my patients is a sit to stand. There's lots of variations of the sit to stand. It's very versatile and very easy to manipulate. So a simple sit to stand using no hands. You want to find a chair that's about standard height. Cross your arms across your chest, lean forward, push through the floor, push through your heels, and stand up. Then to reverse that, you're going to slowly lower yourself back down. We don't want any plopping. So to modify this, if this is too difficult, you can always elevate the seat a little bit. I'm just going to demonstrate by putting this block. You can use a pillow. Just whatever you decide on, just make sure it's stable. And then that lifts me up just a little bit to make it a little easier. But same thing, push through the heels and then slow lower back down. When you go to sit down, you want to make sure you're hinging through the hips, pushing the hips backwards as you sit down. And you want to do that slowly. You don't want that plop. A couch is typically not the best place for you to do this because most couches sit very low. So another way that we like to modify this is adding weights, of course, and then also elevating the feet up. So if I had another yoga block, I could put the other yoga block under the other foot, and that would make it a little bit more challenging. But even we could do it this way too, with one foot on the step, and then step up this way. We could cue you to push more through the foot that's on the step. Okay, and if you don't have a block, you can also stagger your feet, one forward, one backward, and the foot that is backward is going to be the one that is working harder. When we teach you these, we are looking at symmetry. We're looking at, as you come up, are you shifting your weight? Are you able to keep equal weight through both feet? And are you losing your balance? Are you having to push up with your arms to get up? So a sit to stand is a great exercise. You just want to make sure the chair that you're using is stable. A lot of the times I'll tell patients to push that chair up against the wall so that we make sure that chair doesn't decide to slide out from under you. All right, so I know that was a lot of information. We talked about knee range of motion, stretching of the legs, some muscle activation exercises, some basic strengthening exercises, and a few advanced exercises as well. As always, I do recommend that you speak with your surgeon, your physical therapist, to make sure all these exercises are safe for you to perform. You can always follow along this video. You can pause it, do the exercise, and then move on to the next one. This video is intended for education purposes only. Again, make sure you are contacting your medical provider. So one thing I also want to mention is, as a physical therapist, I hear patients say PT stands for pain and torture. That is not the case. As a physical therapist, we are here to help you. The last thing that I want to happen is that you leave our clinic with more pain than when you came in. Physical therapy is not intended to be painful. I know it can be sometimes, but in most cases, that is not necessary. Do these exercises to your tolerance, and don't overstretch. Don't overstress your joints. Physical activity is very important for your health and for your well-being. I hope this was helpful. I do plan on doing more videos. Let me know if you guys would like more advanced exercises for the knee, and I will certainly put that together for you. Thank you all very much, and I hope you have a great day.